Hello and good evening, everyone. I want to thank you all for joining us this evening. It's my absolute pleasure to introduce tonight's speaker, Dr. Olusegun Oseni, a highly respected leader in both conventional and integrative medicine. Dr. Oseni is a board-certified pulmonary and sleep specialist, a functional and integrative medicine specialist, and the medical director of Alpha Care Wellness Center. He is also one of the very few certified Shoemaker mold treatment protocol practitioners in the country, making him uniquely qualified to address the complex challenges of mold toxicity and chronic inflammatory response syndrome, also known as CIRS. In addition to his clinical expertise, Dr. Oseni is the co-author of the groundbreaking book, Health Spangevity, Unlocking Longevity and Vitality, which brings together decades of experience in optimizing health and extending wellness. Before we begin, we kindly ask that you keep your microphones muted throughout the presentation to minimize any background noise. If you have any questions for Dr. Oseni throughout the presentation, please feel free to type them into the chat at any time. We will do our best to address them during the session, and we've reserved the final 10 minutes of the presentation to exclusively answer any Q&A to make sure that we're getting to everybody. Everyone, please join me in welcoming Dr. Oseni as he shares his expert insights on identifying and treating mold toxicity and CIRS.
Hello, hello. Good evening, everyone. Thank you for joining us on this webinar session about SIRS and biotoxin illness. We're very excited about this topic, and we hope at the end of this session we can impact as many people as possible and also increase the awareness because it's becoming a more prevalent condition that we cannot ignore. So once again, thank you for joining this session. I'm going to try and operate my slide, and thank you for the introduction, Kinley. All right. So chronic inflammatory response syndrome is an entity that for many, many decades ago, we didn't have a good understanding on it. But over the last 1 to 2 decades, it's becoming more prevalent. And there are multiple reasons for this. First and foremost, about 50 to 80% of buildings in United States are water damaged buildings, either from water leaks or from internal issues going on because of our building codes. Because of trying to make our buildings more efficient over the last 2 decades, our buildings are very, very tight to conserve energy. And the way we build our structures now, it just makes it much more easy to have mold infestation. So you can imagine if 50 to 80% of our buildings have mold problems, then it's a big issue. As we're gonna try and highlight throughout this uh, seminar, it's become more prevalent, especially since COVID. And the reason for that is because COVID is a biotoxin as well, and that just triggers the same pathway and makes things worse. So, in a nutshell, chronic inflammatory response syndrome is a multi-system, multi-symptom illness. It's very complex, and we're going to go over this. I mean, we're not going to be able to cover a lot of ground because it's such a very diverse condition. But what we try to accomplish with this webinar is to just bring the awareness, answer some questions, and help people to recognize the symptoms because there are a lot of people that are very sick, ill, and they've been to multiple doctors on multiple medications and they're just not getting better. So when we get exposed to mold, Normally, our immune system, which the initial part of our immune system, which we call the innate immune system, identifies the mold and it transfers it to our adaptive immune system, where we build antibodies and we're able to get rid of the mold and the toxin through our stool. Unfortunately, 25% of the population have a genetic abnormality. So the innate immune system recognizes the mold and the bowel toxin, but unfortunately, unable to transfer it to the adaptive immune system to create the antibodies to get rid of the toxin. So it's stuck in the initial phase of the immune system called the innate immune system, and there's an upregulation. That compound of the innate immune system cells and the bowel toxin creates what we call a cytokine storm, where there's a release of different types of substances because of the chronic inflammation. It's like having flu every day for the rest of our life because of the trigger of the immune system and the chronic inflammation. And this leads to what we call the multi-system, multi-symptom illness, which we call chronic inflammatory response syndrome. It's very complex, but we're going to try and make it easy. That's our goal today. So this slide just depicts everything that's going on in this illness. Dr. Shoemaker, who is the pioneer of this condition, has been doing research in this space for about 40 years, and he was able to like identify the process. So just like I mentioned, when a patient gets exposed to mold and builds a bowel toxin, we're able to get rid of it when we're able to create the antibodies. Unfortunately, just like I mentioned, 25% of the population, they have a genetic abnormality where they're just not able to create the antibodies to get rid of the bowel toxin. And it triggers increased cytokines. Those cytokines cause a myriad of inflammatory cascades. As you can see here, it's affecting every part of our body, from causing our blood vessels to vasoconstrict, where we're not getting blood flow, which leads to fatigue and muscle cramps and shortness of breath. Because of the effect of the cytokines, it affects the part of the brain, the hypothalamus. And this is a very critical part of the brain where there's a lot of substances that gets dysregulated, especially this substance called MSH, melanocyte stimulating hormone. It's a very powerful neuropeptide that coordinates a lot of things in our body. And in patients that have SIRS, it's markedly suppressed. And this leads to disturbances of our sleep. It causes our endorphin to be suppressed. And we need our endorphin to be able to adapt to chronic pain. So there's an upregulation of our pain system. So you're going to have a lot of patients with chronic pain, neuropathy, atypical shooting pains because of the dysregulation in our perception of pain. It affects our gastrointestinal system, and you can see it leads to what we call a leaky gut syndrome because this MSH is very important to keep the membranes intact. When it's low, it affects the membrane junctions in our GI tract in our brain, and where it leads to what we call leaky gut syndrome, and patients present with chronic diarrhea, constipation, abdominal pain, malabsorption. Because of the prolonged inflammatory response, there's difficulty controlling our immune system. So we're susceptible to infections. It affects our cortisol, and we all know what the cortisol is important for our body. When it's dysregulated, it leads to multiple dysregulations, especially in our glucose metabolism. It leads to high glucose level. It affects our sex hormones, and we're going to talk about that. It affects our ability to, keep our blood less concentrated. We're just peeing all the time because of our suppressed ADH level. It affects our immune system, and we have different kinds of bugs that, especially the what we call the marcons in our nasal passage. As we go ahead with this webinar, we'll be able to highlight some of this. But as you can see, it's affecting different multiple systems. And that's a major sequelae of exposure to mold in somebody that doesn't have the immune system to get rid of it. So from exposure, it goes to immune system response, then immune dysfunction, and then a chronic inflammation, which just propagates this ongoing symptom. So this slide shows what we call symptom clusters. With SIRS, what we've been able to do is to have all the symptoms in different clusters. Fatigue, weakness, body aches. As I mentioned, it affects the brain. It causes significant memory impairments, brain fog, difficulty concentrating. It affects our temperature swings. We're not able to control it. So we're having colds, swings and temperature, unusual hot flashes. That's been seen in this condition. Blurry eyes. We have, just like we said, GI symptoms, teary eyes. Very classic static shocks is very common in this condition. When somebody, touches the doorknob and they have static shocks, that's a red flag for SIRS. And because of the dysregulation in our ADH and excessive test and urinating, this condition is associated with POTS, where we have sudden onsets of heart rate dysregulation, heart rate going fast, blood pressure dropping. As I mentioned, a lot of GI symptoms as well. This slide just also depicts what I was talking about. From head to toe, it's affecting the whole body. You can see it's linked to hair loss, it's linked to chronic migraines, it affects our ability to, coagulation. So there's a lot of bleeding disorders, nosebleeds, chronic sinus infections, just painful lymph nodes all around our body. It triggers asthma, it makes asthma worse, it affects the cardiovascular system, irregular heartbeats because of the autonomic nervous system dysregulation, a lot of shortness of breath. GI symptoms, as mentioned, decreased libido. It's very common. Um, Numbness, tingling, unusual pain at sites where there was no prior trauma. Skin rash is very common because there's a histamine oversensitization. There's mast cell release, and there's a lot of urticaria, eczema, rash, hives. As I mentioned, joint pain, fluid retention, and tingling of the feet. Um, And you can see there's a lot of different conditions that it's been linked to this, which we're going to talk about. You know, people being diagnosed with depression, anxiety, chronic fatigue, chronic fibromyalgia, chronic anemia, and they've been treated with different medications, but they're just not getting better. Just like we said, the source of mold can be everywhere, especially in our homes, in our offices, schools, you know, buildings, the post office, our churches, federal buildings. Now we know even in our vehicles, we harbor a lot of mold in our vehicles as well. So it's everywhere. Mold is everywhere. And that's why chronic inflammatory response syndrome has become a pandemic, especially over the last 5 years after the COVID pandemic and also with the COVID vaccine. These are all biotoxins that trigger the same pathway. This cartoon also just highlights some of the things that I've already mentioned, but just to go over a few of them, you know, when you have somebody that just cannot control their stress level, a lot of anxiety, depression, brain fog, it triggers autoimmune disease as well, and leaky gut, a lot of GI symptoms is linked to this condition. So, what's the criteria to identify and define chronic inflammatory response syndrome? Usually, once you have about 8 out of those 13 cluster symptoms, based on the slide that I showed earlier on, and there's a strong evidence of prior biotoxin mold exposure. But a lot of times, we might not even remember when we got exposed to mold. It could have been 20, 30, 40 years ago. And because we just do not have the right genetics to get rid of the biotoxin, it just keeps recirculating in our body. And we have clients that come to us that have been to 15 different doctors, they're on like 30 different medications, and they're just not getting better because the grassroots problem hasn't been dealt with, which is the chronic inflammation from the bowel toxin. We have some laboratory tests, but usually once we have the cluster symptoms and a history of exposure, 98% of the time it's highly suggestive of chronic inflammatory response syndrome. But we have laboratory tests to measure the biomarkers to support the diagnosis. And then with patients that have chronic inflammatory response syndrome, CIRS, when you treat the patient, there's improvement. And we're going to talk about the protocol that was created by Dr. Shoemaker. As Kinley said, I'm one of the few physicians in the country that's certified in Shoemaker protocol for treatment of bowel toxin illness. So, as highlighted here, just to kind of summarize, we need a good history of biotoxin exposure. It's not only mold, it could be Lyme, it could be a previous history of tick bite, it could be a COVID infection, it could be EB virus. There's a lot of different biotoxins that we've come to realize that triggers this condition that we call SIRS, including post-COVID syndrome. Once we have 7 or 8 out of the 13 clusters of symptoms, it's very classic for this condition. So we have this visual contrast sensitivity test, which basically measures the blood flow behind the retina. Because of the vasoconstriction of the blood vessels, patients that have this condition are not able to like differentiate different contrast sensitivity. This condition has actually been around for more than 50 years. It was actually created in the military to screen, officers for biotoxin exposure. As I said, there are various laboratory tests that we can do, including the HLA genetic testing. That's the abnormal gene that makes us susceptible to biotoxin inflammation because we cannot make the antibody to eradicate it in our body. We have the biomarkers, the cytokines. We have the EMI test, which is testing for mold and the other biotoxins, the actinomyces, endotoxins. I want you to know that this condition is not just about mold alone. We have other biotoxins in our home, including and especially actinomyces and bacterial endotoxins, especially if we have leaks from our sewer system. There's a lot of endotoxins that gets released into the house. I mentioned earlier about the Macon nasal swab. This is the staph coagulase negative that sits in our nasal cavity because of the immune dysregulation. It just sits there and causes release of additional toxins that just makes this condition worse and worse. We do a lot of neuroquant brain MRI. This basically helps us to see the part of the brain that's shrunken by this chronic inflammation and areas of the brain that's swollen. It's a very good test because when patients are treated with this condition, after treatment, after they go through the protocol, when you repeat this brain MRI, there's significant improvement in those changes. There's a gene test which basically, you know, displays all the different genes that's overexpressed in this condition. There's a lot of other slew of tests that we usually do based on patient symptoms, you know, hormone testing, stool testing, patients that have a lot of shortness of breath or tachycardia, we do echocardiogram to see what their cardiac function is doing, and especially to assess their pulmonary arterial pressure, because pulmonary hypertension is very common in CIRS. And then pulmonary function test, because asthma is very common, pulmonary fibrosis, scarring in the lung is very common in this condition because of the cytokines, especially the MMP9 that's elevated. There are lots and lots and lots of different conditions that's associated and linked to CIRS. This slide just highlights a few of them. We couldn't squeeze in everything into this slide, but I just want you to have the awareness that a lot of the memory loss, dementia, early dementia, a lot of it we're finding out now that they are linked to CIRS, Parkinson's disease, ALS, multiple sclerosis. If you go through the testimonials on the Surviving Mold website, there are patients that have been bed bound because of misdiagnosis, and they eventually got diagnosed with the right disease, CIRS, and after going through the treatment protocol, they eventually got better. They were able to get out of the wheelchair and eventually, slowly, slowly start to move around. We've got testimonies of people that were diagnosed with ALS that eventually they started able to run and even run marathons. And that's amazing. This condition is linked to chronic headaches. Chronic headaches, um, patients are diagnosed with migraine headaches. They've been on multiple medications, but they're just not getting better. Chronic fatigue syndrome, fibromyalgia, depression. There's a lot of chronic pain, unusual pain in multiple areas of the body. Immune suppression, recurrent infection. They're just not getting better. They've been on multiple antibiotics. As mentioned, it can cause a lot of pulmonary conditions, including asthma, recurrent lung infections, pulmonary fibrosis, and also blood clots, pulmonary embolism. It's linked to chronic sinus infections, just back to back. As previously mentioned, it causes a lot of GI symptoms. You know, patients have been to gastroenterologists, they've done colonoscopy and upper endoscopy. They couldn't find anything, but they're still symptomatic. They're having diarrhea, fluctuating with constipation, and just not getting better. And then they finally get diagnosed with SIRS, and their symptoms significantly turns around. PANS, pediatric acute onset neuropsychiatric syndrome. I'm going to spend a few minutes on this. This is becoming more and more prevalent. You have a young child that's been doing very well, and all of a sudden, out of the blue, they start throwing tantrums, behavioral problems, difficulty concentrating in school. This has been well documented. There's been a lot of research about the link between PANS and mold exposure and bowel toxin induced chronic inflammatory response syndrome. Autism, a lot of autism and ADHD that's due to this condition of SIRS. And I also mentioned the histamine imbalance because of activation of the mast cell. So we have a lot of patients that will have a lot of hives, urticaria, skin rash. They're just itching all the time. Just like I said, this is just a few of the conditions that are linked to SIRS. I can go on and on and on, including infertility. We have so many of our clients that we treat with this condition that even without them trying, they got pregnant within 3 months. And we have about three or four of those in our practice that it suppresses fertility because of the hormone dysregulation. And treating this condition just improves that fertility. So, how do we treat this condition? I'm going through this slide so that we can have time for a lot of Q&A so that we can take a lot of questions. Like I said, it's a very complex condition that we can't do justice in 1 hour to go over everything. But the purpose of this webinar is to just create the awareness about SIRS and know that a lot of the diagnoses when you have someone that's been sick for years and years and just not getting better, we need to look into possibility of it being a bowel toxin induced chronic inflammatory response syndrome. So Dr. Shoemaker was able to come up with a treatment protocol after years and years and years of research. And just to highlight this, it's a 12-step protocol, but the first and most important step is removal from ongoing exposure to a bowel toxin. If the house has mold, then it has to be remediated, or the person will have to move out of the house. Otherwise, the cascade will just continue to go on and on and on and on, unchecked. So, getting rid of the bowel toxin, the mold, is critical and the most important step. Then the next step is treating with a binder. The most potent binder is the cholestyramine. There's some other ones. They're less potent, but they help. But some of the regular binders like active charcoal do not work in this condition because cholestyramine has a special property that's able to bind to the bowel toxin. And instead of the bowel toxin just keeps recirculating in the body, the cholestyramine binds to it, doesn't let it get reabsorbed in the liver and the biliary tract, and we're able to like pass it out in our stool. So it's a very critical step. And a lot of times when we start the cholestyramine, after about 4 to 6 weeks, patients are able to pass that VCS test. So we use that VCS test as a good marker of response to treatment. As I mentioned, there's this bug that we call MACONS. It's called a multiple antibiotic resistant coagulase negative staph. Because of the suppressed immune system and the low MSH, it just has the affinity to hide in the nasal sinus cavity, and by itself, it's releasing additional toxin. So we treat the marcons by using a special nasal spray to eradicate it. And as you go down the cascade of the protocol, there's so many things that are dysregulated that we have to address one step after the other. But the good news is that most patients, 90% of the patients, by the time you get to level three, they're like 95% better. So not everybody have to go down the cascade, but the VIP is the granddaddy, is a nasal spray that helps to correct a lot of abnormalities in the brain, in the lung, and in the GI tract. It's called a vasoactive intestinal peptide. So it's a very important treatment protocol. You can't skip steps. You got to go through one step at a time, and you have to pass your VCS test and pass your and clear the markers before you can proceed down the treatment protocol. We're very big into integrative approach to treatment of any condition. So in our practice in Alpha Care Wellness Center, we're big on supporting each system while we're going through the treatment protocol. And we have different, supplements, supporting system to kind of help the brain, the gut, the mitochondria, reduce inflammation. We do a lot of optimization of the detox pathway. We do a lot of injections and infusions, especially glutathione, which is very good in optimizing the detox pathway because we want to be able to like help the binder get rid of the toxin out of our system. We do a lot of nutritional counseling because it's not just mold in the house that's a problem. What we eat also, we eat a lot of moldy stuff, especially gluten. Okay. There's a lot of moldy diets. So we recommend and we counsel our clients on the type of nutrition. We do a lot of gut restoration as well. As highlighted here as well, we help with all that process. And this is a quick summary of chronic inflammatory response syndrome, how to diagnose it, how to identify it, the symptoms, the testing. I went through quickly the treatment protocol. It's a whole lot more extensive than this. And, you know, the take-home message is that you can imagine if 50 to 80% of our buildings have mold, and 25% of the population have a genetic abnormality that makes them susceptible to having these conditions. So you can imagine there are lots and lots and lots, millions of people that are not yet diagnosed with this condition, but they've been diagnosed with a wrong condition and they've been sick for years and years and years. So I hope this brief presentation helps to just ginger your appetite about this condition. I'm going to hand over to Kinley to coordinate the next phase of this webinar so that we can take as many questions as possible and hopefully we can make an impact. Thank you.
Thank you so much, Dr. Osini. We have a few questions here in the chat, and then I also have some questions that were sent to us upon the registration. So they were sent via email.
Okay.
So first question looks like it's from Julia. How do I know if it's mold making me feel awful or if it's just allergies or burnout?
Okay, very good question. So there's mold allergy and there's mold induced chronic inflammation. So usually the way you'll be able to know is if someone enters a moldy environment and all of a sudden they start having a lot of sneezing, a lot of nasal sinus congestion, wheezing, shortness of breath. Usually that's mold allergy that gets triggered within a few minutes, a few hours. This condition that we're talking about, it's from the mold toxin. We call it mycotoxin. And usually it's a slow process. It's usually a minimum of 3 months before patients start unravel with the symptoms. However, there's some patients that have this condition called CIRS that when they enter a moldy environment, they can tell. Their body will be able to tell right away. They'll be able to because they're very sensitive to mold and chemicals and everything. So, but to answer the question, there's a difference between mold allergy, which is the rapid onset of sinus congestion, nasal congestion, wheezing, and this chronic congestion. This is like 3 months or longer before people start to manifest it.
Thank you for that. Let's see. The next one. Oh, this is a very common one. We actually get this question a lot in the practice. So is this testing and treatment covered by Medicare?
So the treatment of SIRS is not covered by insurances because insurances do not understand anything about this condition. However, some of the labs, some of the imaging that we've been able to get insurance to cover. But this condition is under the umbrella of functional medicine. So it's still, we're fighting with the Congress. There's a lot of behind the scenes. I just went to a conference just a few weeks ago on chronic inflammatory response syndrome, and we're lobbying. We're lobbying so that this can be mainstream because of how prevalent this condition is. But as of this time, is not covered by insurance. Some of the treatment, some of the testing we're able to kind of push through with insurance.
All right. The next one that is in the chat, are all types of mold harmful or only certain ones linked to SIRS?
So there's certain ones because there's what we call normal benign mold. Okay, we need actually mold. It helps us with our normal flora and everything. So there's a benign mold that it's harmless. However, we have the toxic molds, and there's a long slew of that, including the black mold that's very harmful because they release a mycotoxin that's very harmful to the body that initiates this disease entity. Good question.
Okay, so it looks like our question about the Medicare actually sparked some interest. Sim1C or Simone, I believe, is asking, how can I help you with lobbying? I'm assuming for the for the Medicare coverage.
Well, I mean, it's an uphill battle. The problem is there's so many big powers. You know, a lot of schools, a lot of um big, you know, housing, they lobby to try and not get this condition into the mainstream because obviously, you know, even now we're able to help our clients with lawsuits and everything when they get exposed to mold in a big building or at work and everything. But that's a lot of people lobbying against, you know, trying to get this condition into mainstream. How can you help? You just go start with your local rep and just climb up the ladder. But you can go on the Surviving Mold website. There's some information there that can help you. And also the Cirs X, and we'll be able to list that website where you can kind of join the big force. The recent conference that I went to last month, it wasn't just for physicians, it was for physicians, patients, you know, home inspectors, home remediators, everybody coming together. So it's a good platform where we're continue to, you know, trying to make our voice heard. And there's a lot of research that's been done over the last 30, 40 years. So it's, if you Google chronic inflammatory response syndrome now, you see a lot of studies. So that it's slowly getting there, but it's just not there yet. Good question.
All right. I'm gonna go ahead and move on real quick unless some pop up in the chat. Feel free, guys, if you're even if you're just joining us and you have some questions that you've been thinking about asking Dr. O, we'd love to see them in the chat. But I'm gonna move on to the ones that were submitted to me. So the very first one that I have, is it even possible to start healing from mold illness if you're still living in the exposure? That's a good question.
It's a good question. It's difficult. Just like I highlighted, you need to be, you need to get rid of the molds. You need to remove the exposure because even when you go through this treatment, if you're still getting exposed, it just triggers that cascade again and again and again. Yes, you're gonna feel a little better, but it's just gonna be difficult to get completely better because the mycotoxin just triggers that cascade again and again. And even when the exposure has been removed, because of the genetic abnormality, when people with that genetic abnormality go to environments where there are molds, it can trigger the whole thing again. So a lot of our patients, we recommend for them to be on a low those binder. And then when they go to a moldy environment, they kind of crank it up so that it kind of helps them get rid of the toxin from their body. But yes, they need to try and avoid the exposure.
All right. Okay, so the next one I have, ooh, this is a really good one. You're gonna like it. Are there any supplements that you swear by when treating patients with mold toxicity?
Oh, yes. There's
Mm-hmm.
a slew of them and I think I highlighted because you want to support every system, especially the brain. The brain is getting a lot of damages from this chronic inflammation. So we have a lot of different brain supports that helps the brain. Omega fatty acid to help every cell membrane that's getting disrupted and getting damaged. And then glutathione is very, very helpful in this condition because it just ramps up our detox pathway. We need to support our mitochondria. That's the power engine in our cells. And this condition just suppresses it, and we're not able to make ATP, which we use for energy. So we have different supplements, which we're gonna which you can see on our website that we use to support the brain, support the gut, support the mitochondria, support the cell membranes. And we have patients on IV infusion of glutathione and NAD to kind of help them recover from the inflammation and get their energy back. So yes, we have a lot of different supplements that we currently use, and we've gotten a lot of great testimonies from it. Good question.
Okay, so I'm going to take a break from the questions for just a moment. I do want to touch on some things that we here at Alpha Care Wellness Center do specifically for our patients that we are treating for mold. Dr. Osini and Dr. Catherine both see a ton of patients who are exposed to mold, struggling with mold exposure, don't even know that they have mold exposure. So we have created a full spectrum, individualized approach because we understand how confusing and isolating that this journey can be. That's one thing that our patients talk about often is that they feel so alone, they feel unheard, and they feel like, they cannot figure out what's going on, especially with all the brain fog.
Yeah.
We begin with the specialized functional lab testing, which goes beyond standard panels to uncover hidden imbalances. We also utilize imaging and mycotoxin testing to get a complete picture of your internal environment. From there, we build custom treatment plans that may include compounded prescriptions and targeted nutraceuticals, many of which come from our own line, Alphaceuticals by Dr. Catherine. There's a ton of things that we can use for our patients, and they're right here in our office, or we can ship them to you. For deeper support, we do also offer, like he mentioned, the IV therapy, precision injections designed to detox, nourish, and heal our bodies at the cellular level. So everything that we do here at Alpha Care is tailored to each patient individually because not one mold case is the same as the last. So if you're ready to take your next step with healing, we are here and we'd be honored to walk that road with you. That brings me to our very, very last question, Dr. Sinney. What kind of symptoms should make someone start thinking mold could be the issue?
Good question. So just to kind of summarize what I'd said earlier on, when you have somebody that's had this myriad of symptoms that just do not add up, chronic pain, stabbing pain, chronic fatigue, chronic headache, always tired, always having GI issues, recurrent infections, and you've been dealing with it for months and months and months, and it's just not getting better. Then that should trigger that person to look into this condition because until the bowel toxin is eradicated, all those symptoms will just continue. And there are people that have been dealing with this for decades, 3, 4 decades, and not knowing exactly what's going on with their body, and they just continue to deteriorate. So it's better to identify it early. So any condition that are listed with those symptoms that's not getting better in 2, 3 months, it's time to look into this condition. And it can affect any part of the body. That's what I would recommend. If not getting better in 3 months and you have all these multiple symptoms that don't add up, it's I will highly recommend to start looking into mold or other biotoxin related illness. Good question.
All right. I know I said that was our last question, but I just want to open the floor up if anybody wants to turn their mic on and ask you a question or put a last minute question in the chat. We can kind of take a look here and see, or I think there's a button on here. You can raise your hand too if you have a question. So we'll give it just a few seconds.
Right. So just to kind of um with Cirs treatment, it's a we customize the treatment for our clients because every Cirs patient is going to be different from the next one. What one patient is dealing with is going to be different. So we customize their treatment, their protocol based on what predominantly they're dealing with. So it seems overwhelming with all the different symptoms and where you can, but most patients, they just have certain major areas of their systems that have been affected. So the treatment protocol is tailored towards that. So that's what we call it, a customized protocol. So I just wanted to throw that out there.
Awesome. Well, Dr. Osini, we really appreciate you taking time out of your evening to go over that. This was one of our most requested webinars ever since we did our last detox webinar back in April. Everybody wanted to know what we need to know when you're going to do a mold one. So we do really appreciate your time this evening. I think that you've answered a lot of questions. And we look forward to hearing some more about some future findings. You know, medicine is ever changing. So we're very
Absolutely.
excited. And so stay tuned for some more things coming out from Alpha Care Wellness Center and Dr. Osini and Dr. Catherine. We have some really exciting things coming up within the next few weeks. And I know y'all heard me briefly talk earlier in the beginning about his book that he co-authored. So that will be launching pretty soon as well. Just follow all of our pages and you'll be able to be up to date on when that book launch will be, when you can expect to see it. So we again thank all of you guys for taking time out of your evening tonight to join us and get some insight on a deeper aspect that is not touched very often.